Hello, now I want to talk about the bones of the upper limb and the joints in between them. The bones of the upper limb are generally divided into some major parts. The bones of the shoulder girdle, which consists of the clavicle and the scapula. Then we have the bone of the arm, and that is the humerus. Then we have the two bones of the forearm, the radius and ulna. Then we have bones of the hand, which are again divided into some parts. Firstly, we have bones of the carpus, or the carpal bones. They consist of two rows, a proximal and a distal row, and then we've got bones of the metacarpus, or the metacarpal bones, and of course the phalanges. Okay, so there are some joints in between these bones. Firstly, we've got the shoulder joints. The shoulder joint is formed by the articulation of the head of the humerus and the glenoid cavity of the scapula. Next, we have the elbow joint. The elbow joint is formed by the articulation of the capitulum of the humerus with the head of the radius plus the articulation of the trochlea of the humerus with the trochlear notch of the ulna. Next, we have the wrist joint. The wrist joint is formed by the articulation of the distal end of the radius with the scaphoid and lunate bones of the carpus. So, it is very important to know that the ulna is completely excluded from the wrist joint. Then, between the radius and ulna, we've got two joints. Superiorly, we've got the superior or the proximal radio-ulnar joint. It is formed by the articulation of the head of the radius with the radial notch on ulna, and inferiorly we've got the inferior or the distal radio-ulnar joint, which is formed by the articulation of the head of the ulna with the ulnar notch on radius. Then we have the carpo-metacarpal joints. These are formed by the articulation between the distal row or between the bones of the distal row of the carpus with the proximal ends of the metacarpal bones. Then we have the metacarpophalangeal joints. They are these joints. They are formed by the articulation between the distal ends of the metacarpal bones and the proximal ends of the phalanges. And then finally, we've got a bunch of other joints that are called the interphalangeal joints. These joints are between the phalanges of the digits, and that should be all about the bones of the upper limb and the joints in between them generally. Okay, so today we are going to talk about the humerus. It's the bone of the arm. This is the right humerus. The humerus articulates with the scapula at the shoulder joint, and it also articulates with the radius and ulna at the elbow joint. We're now going to isolate the humerus. And we're going to take a look at the parts and the surfaces of the humerus. Firstly, it's important to know that the humerus is divided into three major parts: the upper end, or the proximal end, the shaft, and the lower end, or the distal end. At the upper end, or the proximal end of the humerus, we've got head of the humerus. The head of the humerus articulates with the glenoid cavity of the scapula to form the shoulder joint. Below the head, we've got the anatomical neck. Below the anatomical neck, we've got two tuberosities, the greater tuberosity and the lesser tuberosity. They are separated by a groove that is called the bicipital groove, or the intertubercular groove. The intertubercular groove has got two lips. The lateral lip is called the crest of the greater tuberosity, and the medial lip is called the crest of the lesser tuberosity. Below the two tuberosities, where the upper end of the humerus joins the shaft of the humerus, is the surgical neck. It is called the surgical neck because it is important surgically, as most fractures happen in this area. Now we're gonna move to the shaft of the humerus. The most important thing that we have in the shaft is the deltoid tuberosity. So about halfway down the lateral aspect of the humerus, there is an elevation which is called the deltoid tuberosity. Then behind and below the deltoid tuberosity, we've got a groove which is called the spiral groove, or the radial groove. The spiral groove, or the radial groove, transmits the radial nerve and the profunda artery. And now we're gonna go to the lower ends, or the distal ends of the humerus. At the lower end, we've got the medial epicondyle, the smaller lateral epicondyle, Above the medial epicondyle, we've got a border which is called the medial supracondylar ridge. And laterally, or above the lateral epicondyle, we've got a border which is called the lateral supracondylar ridge. Also, at the lower end, we've got the rounded capitulum. This is the capitulum. It has got a rounded shape. It articulates with the head of the radius, partially to form the elbow joint. And we also have the pulley-shaped trochlea. This is the trochlea and it is pulley-shaped. This articulates with the trochlear notch of the ulna, partially to form the elbow joint. So the elbow joint is formed by the articulation of the capitulum of the humerus with the head of the radius and the trochlea of the humerus and the trochlear notch of the ulna. We've got some fossas in the lower end. Above the capitulum, we've got the radial fossa. The radial fossa receives the head of the radius during flexion of the elbow joint. And above the trochlea of the humerus anteriorly, we've got the coronoid fossa, which receives the coronoid process of the ulna during flexion of the elbow joint. However, above the trochlea of the humerus posteriorly, we've got a fossa which is called the olecranon fossa. This fossa receives the olecranon process of the ulna during extension of the elbow joint. And that should be all about the parts and surfaces of the humerus. Okay, so now we are going to talk about one of the bones of the forearm, and that is the radius. Okay, so the radius is the lateral bone of the forearm. Its proximal end, or its upper end, articulates with the humerus at the elbow joint, and it also articulates with the ulna at the superior or proximal radioulnar joint. And its distal end, or its lower end, articulates with the scaphoid and lunate bones of the carpus at the wrist joint. It also articulates with the head of the ulna at the inferior or distal radioulnar joint. Okay, so now if we isolate this bone, it would be like this. And we know that this is the anterior view of the right radius, because we see this tubercle over here, which we're going to talk about. So this indicates the anterior view, and we know that is the right radius because if we go back, The anterior view of the right radius has a curve like this, and this is also true for the ulna. However, the anterior view of the left radius has a curve like this, and also for the ulna. Okay. So now let's go back to the isolated view of the right radius. Alright, so we now know that this is the anterior view of the right radius, and we're going to talk about the parts and surfaces of this radius bone. Okay, so again, generally it is divided into three major parts: the proximal end or the upper end, the shaft, and of course the distal end or the lower end. Okay, in the upper end or in the proximal end, we've got a head of the radius. So this is head of the radius, and this is also considered to be head of the radius, although it's not indicated here as the head. However, we consider it as the head of the radius. Below the head, we've got the neck of the radius, and below the neck, we've got a tubercle or a tuberosity, which is called the radial or the bicipital tuberosity. It is called the bicipital tuberosity because it is the insertion for the biceps brachii tendon, and we can see that more clearly if we search for this muscle. Okay, so this is the biceps brachii long head. We can see that the insertion of this muscle is right on this tubercle, so it is called the bicipital tubercle or the radial tubercle. Here it is. Okay, so let's again go back to the isolated view. Okay, so now moving to the shaft of the radius, we've got the interosseous border medially. So this is the interosseous border. This interosseous border, which is medial for the radius, is the origin for the interosseous membrane, which binds the radius and the ulna together. And about halfway down its lateral aspect, so this is its lateral aspect, about halfway down its lateral aspect, we've got the pronatortubercle. It's not indicated here, but we can see it because the pronatortubercle is the insertion for the pronator teres muscle. When this muscle contracts, pronation of the forearm occurs. So now let's take a look at that muscle. So this is the pronator teres muscle. We can definitely see that the insertion, this is the insertion. We can see that the insertion of the muscle is on the pronator tubercle, and the pronator tubercle is about halfway down the lateral aspect of the radius. So it's called the pronator tubercle because it is the insertion for the pronator teres muscle. So let's go back to the isolated view again. And this was about the shaft of the radius. And to have a look at the interosseous membrane in between the radius and the ulna, we can take a look at this photo here. Sorry, okay. So this is the interosseous membrane, which is colored as green in between the radius and ulna. Okay. So again, we're gonna move on to the distal end of the radius, or the lower end. At the distal end of the radius, laterally, we've got the styloid process, and medially, we've got the ulnar notch, which articulates with the head of the ulna, and posteriorly, we've got a small tubercle, which is called the dorsal tubercle. And this was pretty much everything about the parts and surfaces of the radius bone. Thanks for listening. Now we're going to talk about the second bone of the forearm, which is the ulna. The ulna is the medial bone of the forearm. Its proximal end articulates with the humerus at the elbow joint, and also articulates with the head of the radius at the superior or proximal radioulnar joint. Its distal end articulates with the radius at the inferior or distal radioulnar joint, and we have to know that the ulna is completely excluded from the wrist joint. Now we're going to isolate this ulna. We know that this is the anterior view of the ulna because we can see the notch, this notch over here, and we can see that this is the anterior view of the right ulna because on its medial aspect we've got this tubercle or process over here, which is called the styloid process. We're gonna go over that, but this is just to determine if this is the right or the left. Okay, so this is the anterior view of the right ulna, and now we're gonna take a look at the parts and surfaces of the ulna. Of course, again, it's divided into three major parts: the proximal end, the shaft, and the distal end. Okay, so at the proximal end, we've got two processes which are very important. First is this big process, which is called the olecranon process, and next is the smaller process anteriorly, which is called the coronoid process. And this notch is called the trochlear notch, which articulates with the trochlea of the humerus at the elbow joint. And it is also important to know that on the lateral surface of the coronoid process, we've got the radial notch. This over here is the radial notch, which articulates with the head of the radius. Now, moving to the shaft. The shaft of the ulna has an interosseous border laterally for the insertion of the interosseous membrane that binds the radius and ulna together. And so this red border here is the interosseous border, which is lateral, of course, to the ulna, and the ulna also has a posterior border which is subcutaneous. So it's this yellow border over here. It's subcutaneous, so it's very close to the skin. You can touch it very easily. And it's also important to know that below the radial notch we've got a crest which is called the supinator crest. The supinator crest gives the origin for the supinator muscle. Now today, to take a look at that, we're going to search for this muscle. Here is the supinator muscle. Of course, when this muscle contracts, supination of the forearm occurs at the superior or proximal radioulnar joint. And we can see that it has got two origins. The origin that we need here is the one that is on the supinator crest below the radial notch on the ulna. So it's this one over here. Mark it in red. Okay. So now let's go back to the isolated view of the ulna. And that is about its shaft. And now moving to the distal end or the lower end, we don't have anything so important apart from a small rounded head, which is this over here, and on the medial aspect of the distal end of the ulna, we've got a small styloid process, and this one over here, this is the styloid process. It is smaller compared to the styloid process of the radius, which is lateral to the radius. However, the styloid process of the ulna is medial to the ulna. It is of course important in determining the right or left of the ulna bone. And this is pretty much everything about the parts and surfaces of the ulna. Hope it's been useful. Thanks. Okay, so now we are gonna talk about the bones of the hand, and this is going to be the last part of the bones of the upper limb. Firstly, it's a good idea to know the division or the different parts of the hand. This is the carpus. It contains the 8 carpal bones. They are organized in 2 rows. The proximal row and then the distal row, each of them having 4 bones. We're gonna talk about the bones in more detail in a second. And after the carpus, we've got the metacarpus. So this is the metacarpus. It contains 5 metacarpal bones. And finally we've got the phalanges. So these are 2 phalanges and these are 12 phalanges. So in total we've got 14 phalanges for each hand. Alright, so now let's clear this up and talk in detail about the bones. Firstly, we're going to talk about the bones of the carpus, which are called the carpal bones. We've got 8 carpal bones. They are organized in 2 rows of 4, the proximal row and the distal row. The names of the bones of the proximal row from lateral to medial are these: the scaphoid, the lumate, the triquetral, the pisiform, and then the names of the bones of the carpus of the distal row from lateral to medial are these: the trapezium, the trapezoid, the capitate, and the hamate. It's also critical to know that the hamate has got a tubercle which is called the hook of hamate. It is this tubercle over here. Of course, it's only visible anteriorly. We cannot see it posteriorly. And so it's also a very good indication to indicate if it's the right, to indicate if it's the anterior or the posterior surface of the hand. So if we see the pisiform and the hook of hamate, then it means that it's the anterior surface. However, if we can't see them, it means that it's the posterior surface. Okay. And now, moving to the metacarpal bones, we said that we've got 5 of them, and we name them by numbers. So, from lateral to medial, this is the first metacarpal bone, this is the second, this is the third, fourth, and fifth metacarpal bones. Or we can say that this is the metacarpal bone of the thumb, metacarpal bone of the finger or of the index finger, metacarpal bone of the middle finger, the ring finger, and the little finger. So here it's critical to know the names of the fingers or the digits. This is the thumb, this is the index finger, this is the middle finger, this is the ring finger, and this is the little finger. Okay, so each metacarpal bone has got a base, shaft, and head. We can see them if we isolate them. Okay, this is the base, this is the shaft, and this is the head. Okay, so the bases of the metacarpal bones articulate with the distal row of the carpal bones to form the carpo-metacarpal joints, and the heads of the metacarpal bones, which form the knuckles, articulate with the proximal phalanges to form the metacarpophalangeal joints. And then we have the phalanges. So we've got 3 phalanges for each of the fingers. However, we've got only 2 phalanges for the thumb, the proximal and the distal phalanges. So if there's a spot on this bone, then we're gonna say that this is the proximal phalanx of the thumb. And for the other 4 digits, we've got 3 phalanges, as we said, for each of them. They are the proximal, middle, and distal phalanges. So if we have a spot on this bone, then we'd say that this is the proximal phalanx of the ring finger, or if we have a spot on this bone, then we'd say that this is the middle phalanx of the middle finger. And if we have, let's say, a spot on this bone, then we'd say that this is the distal phalanx of the little finger. So this is how we name the phalanges, and it's important to know that between the phalanges we have joints. They are called the interphalangeal joints. Okay, and this should pretty much be all the information required to know about the bones of the hand. Thanks.